All right, welcome everybody. I see a couple people coming in here. So welcome to our Wednesday live Q&A. So my name is Wes Van Epps. I am an outreach specialist here at Wisconsin Voices for Recovery. And I'm also joined here by a couple of my coworkers. And one of them, Jessica Geschke, she'll be moderating today's live Q&A with our guests. So anybody that's new to our live Q&As, feel free to comment in the comment section, any questions or comments you may have on the topics we talk about today. And then we hopefully we'll have some time at the end if you want to come on camera and ask our guest any questions. So this has just been a great opportunity for us to bring people that advocate for recovery and that are in recovery as well, just to talk about specific topics every week. We've been doing this since the beginning of April this year. So it's just been a great opportunity to hear what other people in the state of Wisconsin, as well as across the country, are doing, just to stay connected during this time. So with that, I'm going to bring on Jessica Geschke, who's going to be taking it away from here.
Thank you, Wes. So, hi, my name is Jessica Geschke. As Wes said, I am an outreach specialist with Wisconsin Voices for Recovery, and I have the honor today to chat with Megan Fisher. I know Megan and have known her now for about 2 years. I think we met at Mobilize Recovery 2 years ago in Vegas. And so I'm really, really excited today, Megan, to chat with you about all the exciting things that you have been doing. So first, I'm going to go ahead and read your bio that you sent over for us, and then we'll bring you on and get talking. So Megan Fisher is the Director of Recovery Engagement at Porter Stark Services in Northwest Indiana. In her professional life, Megan manages multiple federal grants focused on increasing access to substance use and behavioral health services, closing gaps in the continuum of care, and leveraging resources in the Indiana communities. She has over 12 years of experience in behavioral health and has worked in the clinical and administrative levels of residential, outpatient, community mental health, and corrections. She is an active participant of regional and state coalitions, advocating for education and stigma reduction, as well as shaping policy related to substance use disorder treatment. Megan is also a regional lead for the Recovery Advocacy Project. Most importantly, Megan is a person in long-term recovery since April 29th, 2009. She's quite active in her personal life, and Megan enjoys caving, obstacle course running, and weightlifting in her spare time. I got tired just reading that last sentence. So thank you, Megan, for joining us today. Like I said before, Megan and I met at Mobilize Recovery, not this past one, but the one before, when we actually could be together in person out in Vegas. And, Mobilize, for those of you who don't know, Mobilize Recovery is a movement. It's an organization that was created out of the Voices Project and Recovery Advocacy Project. And I think, when I explain that to people, it's a place that we kind of grew and learned and connected. And we met hundreds of advocates from around our country that were selected to attend. And for me, it was life-changing. We learned so many tools, and we really got to plunge into like the advocacy world, right? And what it meant to be an advocate. And I know that coming back to Wisconsin, my head was spinning and I had so many things I wanted to do. And I kind of sat back and watched you from afar, and watched you explode into this amazing, advocate. Not that you weren't already, but like watching you do all these things in your state. And I just became blown away by the number of things and those life-changing moments and those things that you were doing that I was like, okay, what the heck? Like, what is she doing and how can I do it? So I reached out to you and I was like, hey, can you please give me what you have? Because I need some help. And you being, the amazing person you are, you're like, yes, what can we do? And so we started to kind of collaborate on things. And you're no stranger to our Recovery Advocacy Project here in Wisconsin, because we've done some work together with our town halls that Ryan Hampton had led here. Also, we just did the Region 5 Vote Recovery, where our own Monte Ball was our, member, and he represented Wisconsin on that. And then, Recovery Advocacy Project even co-sponsored some of our events here for Wisconsin Voices. So I think, I'd like to start by just asking you, what has it been like for you to have this role in Recovery Advocacy Project? And what has it meant for you to do that?
Wow, that was quite the intro. Kind of want to do like a mic drop. All right. It's a great question, because I was excited to get involved in Recovery Advocacy Project because there was this missing piece of the puzzle that I didn't even know was missing until that first Mobilized Recovery. Like, I'm a person in recovery, so I've been engaged in that world for a long time, right? So, my recovery path has me doing service work and being engaged in a social way with other people in recovery. And then I'm also a professional in the treatment world. And so I had a lens into that piece of the recovery world, which is, working with other service providers and just looking at how we can improve, our services from a professional level. But when we went to that first Mobilized Recovery, I realized there's this in-between point where I can, as a person in recovery, be an advocate and tap into things that are happening at the local level, at the regional level, at the state level, not as a professional, but as a person in recovery, and not as a part of my program, but as a person in recovery who wants to see change happen in my communities that can help other people get involved in recovery. And I had never really been given any guidance on how to do that until that point. Like, I had sort of naturally been an advocate as I became involved in the treatment profession, but I never really had the tools of how do you, to use this, the word of the event, but how do you mobilize people? How do you get other people engaged so that you have a team all?
I think we lost you there.
Can you hear me?
There we go.
Okay. I don't know at what point you lost me, but my last point was just I needed help on how to work within a team environment, how to mobilize people to approach these advocacy efforts together instead of like wearing myself out trying to be a lone wolf out there fighting for the big fight. So that was really my introduction to it. And since then, it's just really fired up my passion in a different way than I've ever been engaged before as just a professional. It's been something that I can do, just straight from the heart, and nobody, like, there's no rules, right? Like, as a professional, I've got a boss, I've got an organization, I've got policies I have to follow. I have all these people that are telling me the way that I need to do things. But as an advocate with my fellow advocates, we get to go, hey, I'm passionate about this particular thing. Let's go in that direction. Like, our community needs that. Let's go after it. And nobody's telling us no. Like, we get to go do what we see needs to be done, and hit it hard. And so that's been the exciting piece, is just the extreme flexibility, creativity, and passion of everyone involved in this together. And so it's been an awesome ride so far.
Yeah, thank you. And something that you kind of hit on a little bit that I'd like you to elaborate on is one of those tools that we did gain and we were taught was the community listening forums, or community listening sessions. And I think now more than ever, we need to be listening to our communities. I feel like there's a lot going on in all parts, not just state by state or community by community, but in our nation, where communities are suffering. And I think they feel like maybe they're not being heard. And you've done an amazing job in Indiana listening to your community. Can you share a little bit about that, that experience and how you did that and how you mobilized, right, recovery inside these communities by hosting these sessions and what that was like?
Yeah, for sure. So one of the one of the biggest things we realize as advocates is that a lot of decisions are made from the top down, right? Like there are a lot of quote unquote leaders out there who believe they know what is best for the recovery community and make decisions accordingly, but it may not really be truly informed by the grassroots level and what's happening on the ground in our communities. So the first thing we realized is we had to start with asking people what it is they needed, not make assumptions, not, base decisions on things that have been done in the past, the mistake of, well, this is the way we've always done it, so this is the way we're going to continue doing it. We really, really needed to get people's voices. So these community listening sessions, they were really casual. They were just like, hey, we're going to meet. One of the ones that I conducted was at a local recovery home, just because like they're typically willing to give up, a meeting room and freely say, hey, come hang out and do what you need to do. Once COVID hit, we held a few virtual ones, but they were all in different settings, all with different numbers of participants. And we really purposely did a diverse reach out to different kinds of communities because, and I'm sure Wisconsin is the same as Indiana. In fact, I know it is with some of your northern communities. There's a big difference between a rural community and an urban community and what their needs are. So we wanted to make sure we were hitting different communities and really getting at the heart of some of the unique features that they have. Rural communities have very specific issues like transportation barriers and things like that. Urban communities have totally different issues. So we tried to get a mixed bag of different kinds of communities we could have these events at. And then we just had casual conversations. And really it was just about, all we had to do was ask the initial question, what do you guys